you want to touch after you look. Yeah, you don't want to annoy the bowel. Another trick, if she is ticklish, when you go to touch her, she might go into a spasm, so have her sing Twinkle Twinkle Little Star. You know, you can't do much when you're singing Twinkle Twinkle Little Star. Or put a pillow under here or a pillow under here. Are you comfortable? Are you having any pain anywhere?
No, right side.
Your right side? Can you show me with one finger where, or is it a one? Okay, so she's not showing me a one finger touch. She's showing me a palm touch. So she's got some pain in through here, even though it might be localized. It's not localized enough for a one finger touch. So we know that when we go to palpate, we're going to leave that right side to last. First thing you want to do is look. I would have her shirt up here to here. I'm looking for the contour, okay? It can either be protuberant, it can be convex, it can be flat. If it is protuberant, she could either be fat, she could have a baby in her belly, she could have ascites. If it's got very pronounced veins and it seems kind of taut and shiny, might be ascites. You press on one side when you get to that point and it'll go, it's like a water balloon. Okay? But looking, the best way to look is to get down with it. Sorry, we back up. We're looking for any kind of scars. Okay? You know, some of your very old clients will have a big, huge gallbladder scar. And they were in the hospital for 9 days, and they had T-tubes. And now, you know, with someone your all's age, you might see a little itty-bitty thing in the belly button because they've taken it out that way. People my generation might have a little one right in through here. Looking for C-section scars, whether they're bikini line or midline. You're looking for anything that you might see. You also want to pay attention to the fact that on the left side, the aorta comes down just a little bit left of center, and then it bifurcates. You probably will never see one, but just FYI, there is a aortic aneurysm, an abdominal aortic aneurysm. There can be a little pulsation right along that aorta. Sometimes there's a little bit of bluish color right underneath the skin where they're doing some bleeding. If you see anything like that, stop and get somebody else, because that could be a medical emergency. In a very, very thin person, you might see a little bit of pulsation, but I'm talking about a thing about the size of an olive. Okay, so when you get down here at the end and you're looking up, you're going to tell her, take a real deep breath and hold it. Okay, thanks. The deal is when she takes a breath and holds it, you will see any kind of mass or lump or bump that should not be there. You're going to see one side, one of her ribs is higher than the other. It's like that with everybody. You're not going to see that looking over her. Who was in lab yesterday when we found that out? It's really cool. When you go down here, you ever take a big deep breath in and hold it, you're going to see the one rib. It does a little bit higher the other. But you're looking for gross abnormalities. Okay, we've looked. We haven't seen anything. We're going to listen. Ms. Watson likes to say, when you listen, you follow the bowel. So we go up the right with the what? Ascending, across for the transverse, and down for the descending. Okay, great. All four quadrants had vowel sounds. I used to teach students, if you don't hear them, listen for 5 minutes. Listen for 5 minutes. Listen for 5 minutes. Listen for... That's 20 minutes. Finally, Miss Watson said to me, No, I'm not. That's what I was saying. She said, you're teaching them wrong. Think about it. 20 minutes. So it's listen for 5 minutes total to try to find a vowel sound. It's not 5 minutes per quadrant. It's 5 minutes total. Sometimes it's normal to not hear vowel sounds. When is that?
After surgery.
After surgery. You just gone under general anesthesia. The bowel is paralyzed, and it's okay. But after about 8 hours, then you need to make sure you start hearing something. The next thing we would do is percuss. But we don't teach percussion because it's considered an advanced assessment technique, but it is so cool if you ever get a chance just to practice on yourself. Practice on yourself because you can hear all kinds of cool sounds. Last thing we do is palpate. We do light palpation, not deep palpation. We're only going to go down about 1 to 2 centimeters instead of deep palpation, which is 4 centimeters. I would normally start at the right, but if her pain is on the right, I'm going to start over on the left. And all I'm going to do is go down 1 to 2 centimeters, and I'm going to walk my fingers across her belly. And I'm going to say, when I get to the point that hurts, let me know. Right in through there. And it hurts when I just put this amount. Okay. So that pain needs to be further investigated. It's on the right-hand side, right down about here. What are 2 things off the top of your head that you can think of? Appendix or ovary. Yeah. So, when you're doing an abdominal assessment, you need to mentally cut her into 4 quadrants. Cross the belly button and up and down here, and know what organs are in the upper right-hand quadrant, lower right-hand quadrant, lower left, upper left. What is in the upper right-hand quadrant? Your liver. What else is there? Gallbladder. What's in your upper left?
Stomach.
Yeah, stomach. Your pancreas kind of goes all the way across. And your lower right, we talked about that appendix and the ovary. Okay. So I'm going to have you go ahead and scoot on over. You've done a wonderful job. Woo! You even give me my payment? Okay. Leave it on the table. All right. Is that, everybody kind of get that? Similar to what you learned the other day?
Yes.
Yep, okay, great. Now, it says palpate bladder for distension. That's optional. Okay? That's optional. Now my favorite. You're not really going to watch me do this, are you? This, I hate this one. I honestly do. The musculoskeletal. We want to make sure we've got 3 areas: joints, muscles, and bones. Okay? And I'm going to take it: joints, muscles, and bones. When we're looking for the joints, we are looking for, we're looking for gross range of motion. When you did your musculoskeletal from your long pack, you probably did every single solitary joint, right? Well, what I care about is, can you move? Can you move? Let me see everything move, and your hips can move. All right, neck can move. She's got pretty good range of motion. We didn't see anything gross. If you want to check for crepitus, you're going to have to hold those joints. What does crepitus feel like? Crackles.
Grinding, kind of.
There are all kinds of joints that have crackles. As a matter of fact, you've got some crackles in both knees. Ooh, this one's worse. You could check the ankles for crackles. Most crackles are